What if I told you that it's not the number of hours you study, but the right strategy that truly helps you pass the NCLEX? Let's begin. Preparing for the NCLEX is not about studying more, it's about studying smarter. Today, we are going to build step by step an effective, realistic study plan focused on the key points the NCLEX actually tests. First, understand this. The NCLEX doesn't test memorization, it tests clinical thinking. It evaluates your ability to prioritize, recognize risks, make self decisions, and act as a newly graduate nurse. That's why your study plan must train how to think, not just what to remember. The foundation of a strong study plan is a clear weekly structure. Ideally, your plan should last 6 to 8 weeks, depending on your level and clinical experience. Each week must include 4 essential components. First, theoretical content. Second, NCLEX style questions. Third, error review. And fourth, active review. One of the most common mistakes is to study only theory for weeks and leaving practice questions for the end. For the NCLEX, questions start on the day one. Second tips. Study day distribution. An effective plan usually includes 5 to 6 study days per week, with at least one active rest day. A practical example. 3 days focusing on content plus questions, 2 days focusing on questions plus deep review, and 1 day for a simulation or general review, and 1 free day or live review. Studying every single day without rest reduces retention and increases anxiety, which the NCLEX indirectly penalizes. How to study content effective. When you study a topic such as a heart failure or infection control, always ask yourself, what is the nursing priority? Which finding indicates immediate risks? What is the safest first action? Do not try to memorize endless lists. Focus on key signs and symptoms, life-threatening complications, priority nursing interventions, patient education, and if you cannot explain the topic in your own words, you don't truly understand it yet. NCLEX style questions, the key to success. This is the core of your study plan. You should answer questions every day, ideally 30 to 75 questions daily. But pay attention, doing questions is not the same as learning from them. Every incorrect question should be reviewed by asking, why is the option incorrect? Which keyword confuses me? What concept did I not fully understand? Even correct answers should be reviewed to confirm that you choose the right option for the right reason, not by guessing. Error review is more important than the number of the questions you complete. Spend at least the same amount of time reviewing errors as answering questions. Create a notebook of digital file with topic, mistake made, correct key concept, endless relearned. Example, when 2 patients are stable, prioritize the one at risk of deterioration. These rules appear rapidly on the exam. Review should be spaced, not left for the end. Use this strategy. Short daily review from 10 to 15 minutes. Weekly review of week topics. Full review every 2 weeks. Use outlines, mind maps, or flashcards, but always with a clinical focus, not pure memorization. Once a week, complete a long question block simulating the real exam with no interruptions, time conditions, and quiet environment. This builds mental endurance and anxiety control. If your performance improves even while still missing some questions, you are on the right path. The NCLEX is adaptive, not perfection based. Mistakes you must avoid. Avoid changing study resources every week, studying only topics you like, ignoring fundamentals such as safety, delegation, and infection control, and comparing yourself to others. Your progress is personal, and the exam evaluates minimum safety competency, not academic excellence. An effective NCLEX study plan is not rigid, it is intentional. It combines a strategy, consistent practice, tactful review, and smart rest. If you train your clinical thinking every day, the exam stops being an enemy and becomes a one more step towards to your professional goal. If this content helped you, we invite you to join to Enfermeras en USA, where we will support you step by step in your preparation as a professional journey. Save and share this video and follow us on our platforms for more real and effective strategies to pass the NCLEX.